Well, thank you guys for joining me. And how do you say it?
It's Galen Hegarty.
Galen Hegarty.
He,
So,
he really likes it when you say Haggerty, though.
No.
and Dr. Susan Gamble. So, thank you for joining me in here in the Trainers Talk. We'll get right into it. We already had a good conversation to start off, but tell me where I am and where are we located right now? I know
You are in St. Helena, California at Napa Valley Private Physician's Office in the Southbridge building, directly above the Health Spa Napa Valley.
perfect. So, tell me a little bit about why you guys decided to come together and put this practice together. What sparked that?
Hmm.
I'll let you start, Susan.
Yeah, I mean, I think I have gotten that question so many times, and I think the easy answer to that is, Galen is just a really gifted physician and an amazing person. And when you find someone like that and you bump into them in your life, you don't take it lightly,
Yeah.
right? And so Galen and I kind of bumped into each other in life in about a year ago now, when a friend introduced us, and he was sort of looking for a job in lifestyle medicine, and we had both just taken a little bit of time off work, which is so difficult to do in medicine.
Yeah.
And so uncomfortable, right? Because we're trained to just work all the time. And we met initially. We were just talking about, what did you do with your time off? And yeah, I took some time off too, and that was really hard. And like, how are you doing it? And then realized that we both have this really similar philosophy of patient care and what we want out of medicine and what makes us happy in medicine. And that's what sparked the business partnership, really, ultimately,
Yeah.
I guess.
Yeah, we both resonate on the quality of care that we want to provide,
Yeah.
and recognizing the time that it takes to give that quality of care. And we were both somewhat had our hands tied with how the level that we could work to with the kind of the guardrails or the boundaries that we were working within. And when we spoke about that and our passion for health and wellness and helping people live to their best, we just resonated so well on that. We're like, we need to do something together.
Yeah, totally.
Yeah.
Is what because you obviously are coming together, so you each have your own specialties, internal medicine and
Family medicine.
family medicine. But I know within that those are very general terms, and I know you have your own specialty. So what is kind of, I'll start with you, Galen. What is kind of your specialty? What is the things that you're really interested in sinking your teeth into as when you're developing this new practice?
Okay. Well, I'm also certified in weight loss. I'm an obesity medicine specialist and a lifestyle medicine specialist, two different fields that you can get additional certifications in training. So I bring that to the table in my primary care practice, which is looking through a lens of what are the barriers to health for you, and how can we remove those barriers? Because the human body can heal itself so well if you remove the barriers that are leading to dishealth.
Yeah.
And so having a lens of focusing on removing the barriers and behavioral strategies to incorporate to improve your health before we lean into the things that we're taught in medical school, such as prescriptions or procedures. So I like to start with that lens, although, being a medical doctor, I definitely work to the other extreme, which are the people who may have missed out on those opportunities for prevention or reversal early in their lives.
Yeah.
And now they have some diseases that have set in, and we need to manage them to the best of our ability. And so that's where my medical training and skills in the 20 years that I've been working so far really come in. But if I can head that off at the past or somehow bring you back to a place of health without procedures or pills, that's my ultimate goal, and that's my passion.
Oh, I love that. And what about you, Susan? What within internal medicine are just something that you're kind of interested in exploring, being able to now have this entrepreneurial kind of spirit in working with people?
The entrepreneurial. I have like zero entrepreneurial bones in my body, just so you know. So like all of this is, I'm very risk averse, which I think makes me an excellent physician and not a great entrepreneur. But and I apologize for the noise, the construction in the background.
Yeah.
The thing I love about internal medicine is, like, when I was in my training, there are all of these like really interesting subspecialties that you can go into. And what I found out about the internist was, like, the internist figures out what's happening and sends you to the specialist, right? And so the thing I love, probably one of the things I love most about medicine, is the process of figuring out what's wrong. So like as the internist,
You're fine.
sorry.
You're totally fine. You're totally fine.
As the internist, I'm the one who gets to work you up, right? Like you come to me with abdominal pain and I get to figure out, do you need an EGD or do you need a CAT scan, or is it, an intestinal migraine and you need to see the neurologist, or is it that you have an ulcer and you need to see the gastroenterologist, or is it that you have something wrong with your aorta and you need to see the cardiologist, right?
Yeah.
So that's the part of medicine that makes me really excited. And, all of the things that Galen said, I think are also, or would also apply to me, in that as much as I love doing that in medicine, what I love more is seeing people really healthy and vital in their lives, and feeling like I'm helping them stay healthy and not just treating them when they get sick. Right?
Oh, yeah. There is definitely, I think the mindset of what you're saying, removing barriers and the problem solving. As much as you don't feel like you're an entrepreneur, you are an entrepreneur now. And I feel like if you take that same mindset, it's gonna, remove barriers. Like you got to figure out what's the constraints in the business and try to remove those. It's the same thing as working with clients, and then the same thing with problem solving. Is this an accounting thing? Is this a facility thing? Is this a resource thing? So the same. So that don't trust your instincts on that. That was just
that's helpful.
Yeah.
Think about that.
And speaking of hurdles, what do you think is your biggest hurdle kind of starting a new practice that you feel kind of?
Well, I can start. We probably have different hurdles.
Yeah.
One of the similarities which you've mentioned already, which is neither of us are business owners.
Yeah.
This would be great if someone said, "Hey, we want to hire you to work our concierge practice, and we're going to manage everything else." That would have been nice, but it doesn't happen that way. So being a small business owner is something that's unfamiliar to me. I'm a doctor.
Yes.
But that's probably the biggest hurdle for me, coming from Sonoma County. Knowing the network of physicians in this neck of the woods, I'm going to have to learn that through Susan a little. But other than that, I think that I'm ready to go. The business aspects and the referral network that's over here in Napa Valley is what I'm going to need to learn. But I think other than that, I've the 20 years of practicing medicine, I've got it dialed in, I think.
Oh, totally. What do you think, Susan? Is there something that's kind of like, a hurdle for you that you're excited to hopefully jump over?
I think, sort of to what Galen said, I feel there's a lot of new things that we're learning, and that's really exciting. You definitely get to a point in your life, I think for all of us in our careers, where we are sort of doing the same thing over and over again. And then, when you have the opportunity to learn a whole new set of skills, it's exciting, but it's also really overwhelming. So I think that's for sure the biggest hurdle for us.
Yeah. And
like,
I actually think that it allows you to set a new culture in a way. Do you feel like what was the disadvantages of working for an organization or a system that you feel like is going to now be an advantage? I feel there's probably a lot there, but I left it open-ended for a reason.
Well,
there are pros and cons.
Yeah, I working for a large organization with the volume of patients that I've seen for the last 20 years. The experience that I've received from having that volume of patients and the spectrum of diseases that I've seen. I couldn't be starting where I am now without having had that experience. So I'm very grateful for having that time. The work-life balance was a big part of it. We're both parents, and we both want to have a good work-life balance with our children, and they're going to be growing up and out of the house before long. And I'll work overtime then, but for now, I'd like to, have a partner who we can share time with, and we can really create a work-life balance where we love our work. We leave work saying that was such a gratifying day, and now I get to go spend time with my kids. And so that's what I'm hoping to gain from this, because I think the organization I worked for before had a great referral network of specialists. I really enjoyed my colleagues and all the resources available, but it didn't have that work-life balance, and creating health for you and your family is just important as your career. And so that's what we're trying to do here that I didn't have at my other
Yeah.
company.
Yeah. I think, you get to, I sort of have this dream of doing medicine in a really different way. And I was so lucky because working at Adventist Health, I felt like they were so supportive of me. And in so many ways up there at my clinic, letting me do things that were like a little outside of the box for a general, medical practice. And, I think also, I wanted so desperately to have a partner. I wanted to, like, when I'm off, I wanted to be off, right? And the larger medical system, not our hospital here, but the larger medical system just couldn't help us with that, And you're in this hierarchy of control when you're in a system. And even if the people right around you are really supportive of you, sometimes the hierarchy, like sometimes everything is happening right in your clinic, and then the insurance piece comes along and takes something away from your patients, right? Or the hospital has to cut a whole program for financial reasons, and something you were counting on doesn't work for you anymore. And I think there's such a benefit to being in a big organization, but the benefit to being able to create like this really beautiful medical home for our patients in a way that we really are excited about. That's what we get to do now. That you can't do in like a traditional system.
Yeah. Totally. What would you say? I know you have previous clients. You're signing up new clients or patients. I call them clients. That's my role, so I call them clients. But what would you say people can expect when they come in and they meet you guys for the first time, and they're excited about working with you? What can they expect that first couple of meetings?
Well, they'll have a pair of doctors, so we're trying to coordinate it so that when you sign up for our practice, you're getting both of us. So you are going to get a second opinion on all of your issues. We're going to try to schedule it so that first appointment, you'll actually be meeting us both for your annual physical, so that we both hear everything you have to say, all your concerns. We're both there to see the physical or perform the physical, and really have two doctors taking care of you at the same time, which you really don't get from a primary care practice. You're going to have a much longer visit than people who come from a traditional practice would have. There's not going to be a time constraint where we say, we've only got 5 more minutes. Can we just wrap it up? We want to hear all your concerns. And so our visits will be much longer. There'll be more comprehensive lab work and screening. And I think that really the care coordination, the communication is something that's really missing in our medical system right now, because everyone's overworked, overburdened, the great resignation of physicians. And so that's where there's cracks forming in our system. And I think that with Susan and I here, being 2 physicians working with a small panel of patients, nothing's going to be missed. We're going to be, like Susan, that analogy, cleaning that plate and making sure there's no spots that have not been left inspected and addressed. And so you're going to get a really comprehensive exam. We want to see you more. We're not going to have you leave and say, well, get in touch next time you have a problem. We're going to say, we want to see you in 6 months, even if you don't have problems, to make sure that the ideas and strategies you have to help improve your health are heading in the right direction. So we'll be more connected with you than, say, a traditional practice. And we're available. We have multiple methods of communication. We'll be available for you every day of the week. And so you hopefully won't have to go to the ER for something minor like a urinary tract infection, or a sprained knee, and you're like, do I need to go to the ER? Maybe a short video visit on a Saturday with my doctor will help me resolve this, and I can see them on Monday and have to stay out of an emergency room visit. So I think that's what we're going to be offering here to our patients that they wouldn't get from a traditional practice. A small sprinkling of what they'll be offering. There's a lot more too.
Yeah. I think the other thing is that, we really want to know what makes you tick, right? Like, we want to know what you want to be doing when you're 80 or 90, right? And we want to work together to get you there. And I think in the traditional medical practice, your doctor doesn't say to you, okay, tell me, like, what does your life look like in 5 years from now, or in 10 years from now, or in 20 years from now? And then how can we work together to get there, right? Like, that's something that you don't normally get in your primary care practice. And Galen and I are both really passionate about, like, your health span and not just your lifespan. And so, you know, if you want to be traveling when you're 85, like, we gotta, you know, you have to be able to, I was thinking about backpacking.
If you want to hike up that hill here in St. Helena when you're 85, like, can you do it at 65?
Through Europe at 85.
Yeah.
You know, so that's different. I think that's something that, you know, you can expect from us that would be a little different than your regular practice.
I also say we both have these backgrounds in lifestyle medicine and health and wellness, and 36 years of personal training myself. I have a lot of knowledge of nutrition and physical activity and so many other aspects of health that really can lay a groundwork for your trajectory when you're 60, 70, or 80. And having the time to talk about that and the knowledge that most physicians aren't taught is something that we'll be offering too.
Which is surprisingly very important, because there is a lot of, you know, I mean, I've been around the country, and still California, for the most part, more people are into health and wellness. One of the reasons I'm out here from the East Coast is that people are into that. And so, you know, having doctors that are, you know, knowledgeable of, you know, what, you know, I want to do this exercise, I want to put on muscle, I'm a woman, I want to put on muscle, or in understanding that what's really optimal for that versus, you know, oh, just stay off it. You know, sometimes when you hear from a doctor, just stay off it for 3 to 6 weeks, but you're like, I'm an athlete. You know, is there a way for me to work around it and heal correctly and stuff like that? And I think those are those gaps that we were talking about earlier that I feel like you guys could fill, which is interesting. So how do people sign up? So they hear this, they're interested in learning more. Where do they go? How do they find out more?
They can find us at napavalleyprivatephysicians.com or napadocs.com. There they can connect with us. There's a contact us link, and through that they'll send a secure message to us, and we'll reach out to them. And then typically we schedule a consultation visit where the individual or the couple will sit down with us and, you know, spend 30 minutes, an hour talking about their health, what matters to them most, what they want from a physician, and to make sure it's a good fit. And then if it's a good fit, we give them the contract and they sign up.
Oh, that's awesome.
Yeah.
Pretty straightforward.
Yeah, I think that's, I mean, we can give you our phone number if you
we give the phone number too.
No, we'll put in that stuff in the bio of the video and the podcast, and I'll probably do an intro. So yeah, this is great. I mean, I would love to I could talk. We can go into details and stuff, but I know you're busy. You're trying to grow your practice, and I just want to get this information out. And I thank you for sitting down with me.
Yeah.
Well, I appreciate your time, and I want to just add to, you're so right, that last comment you made about how a lot of you go see a physician, you've got an ache, they say, well, just rest it for a few weeks.
Yeah.
You'll never hear that from me. Just rest that part of your body for a few weeks, maybe. But I'm going to give you other ideas on how to stay fit and healthy.
Yeah, totally.
Yeah.
We got you a Christmas present.
Oh wow, that is very.
Yes,
come on, you can open it right.
All right, this is very thoughtful. Oh yeah, I'll be rocking this.
All right, maybe we should have gotten a smaller one so you like bulge out of it.
I love it.
That's awesome. That's cool.
Yeah. Merry Christmas.
Yeah. All right, I'm gonna pause this for a second.